Hey everybody, Justin Feldman, Feldman Physical Therapy and Performance, here with Vinny. And so we're going to talk today about some instrument-assisted soft tissue mobilization. We kind of talked a little bit that we were going to start to get some more videos out with some of our different techniques that we use. And this is one of the big ones that we're using here a lot, all the time. So we got a couple different types of tools. This is an edge tool. And so this is sort of the Swiss Army knife of the instrument-assisted tools. Pretty much good for anything, any part of the body, all different types of edges and stuff like that. This is a little bit of a bigger handlebar type tool. This is really good for larger areas, trying to cover like someone's quad or hamstring, something like that. And this is just sort of a little bit more of a delicate tool, kind of good for like feet, ankles. But even with the edge tool, you can get to all that stuff just with all the different edges in here. So biggest thing with this is that what we're not trying to do is we're not trying to leave marks on anybody, and we're not trying to dig in. You're never going to break up scar tissue or release adhesions or any of these other things you'll read on blogs or see on Instagram or any of that stuff. I could dig into Vinny here as hard as I want, leave all sorts of red marks and make him look like he got into a fight and lost, and none of that happens every time you're in a fight, right?
Yeah, that's true.
And none of that's really gonna do anything. You need about 2,000 pounds of force to be breaking that up. But what we are doing is use just sort of a little bit of lotion, and what we are gonna do is kind of pick the broadest surface we can, and we're gonna just kind of move one direction gently. And what we're trying to do is provide just sort of a new novel input into the nervous system so that we can get some of that tissue to relax. And as we sort of get it to relax, we get the nervous system to kind of come down a little bit, not feel as threatening based on whatever your individual situation is that's going on. What this then allows us to do is allow you to get in and do some exercises and some strength training, and maybe even do some stretching to the area that might otherwise be a little bit painful and hurt. And this allows us to do that without that pain and to build those effects. So it didn't hurt, right?
No.
And see, Vinny's a baby, so if it hurt, he'd be the first one to tell you.
Very much so.
So that's our instrument-assisted soft tissue mobilization. Definitely something to give a try and play around with. Very, very effective, and just make sure no one's leaving any marks on you. And we'll see you right back here again in a couple weeks for another video with some different techniques that we're using. Have a great week.